My name's Dr. Kelly Smith. So I'm running for Florida State House District 30. And since we're giving geography lessons to everyone, it encompasses parts of Volusia County and North Brevard. So east central coastal Florida, so north of Cape Canaveral. So places like Port Orange, New Smyrna, Edgewater, Mims, and Titusville, the great Titusville. I know we have some Titusville people on here. And it's great. I have to say, being able to hear other candidates talk about such an important issue tonight on the federal level, but on the state level, there is so much more that can be done. We know everyone is here because we are all for Medicare for all, right? So we know that the status quo for how we pay for and how we deliver healthcare isn't working, right? So I'm a sociologist. I specialize in gender studies and social justice. So I approach the issues around healthcare through a policy perspective that's not clinical, right? I'm a fake doctor. I'm a PhD doctor, not a medical one. So I focus on understanding and then mitigating structural systemic barriers that impact access to and quality of bodily care. It's astonishing to a lot of people that they don't realize that US healthcare spending is the highest of any advanced economy in the world, right? And we face higher healthcare prices than any advanced economy in the world. I know this firsthand. I have had times in my life in which I have had to forego treatment or not purchase medications because they were too costly. And so having to make that choice is really gut-wrenching, and it's staggering and astonishing, especially because being able to get the care you need, the reproductive health care that you need, the prescriptions that you need are human issues, right? These are human rights, basic human rights issues that should be protected and guaranteed. So, my platform overall really focuses on those types of things, right? So extending voting rights, right to quality public education, right to a living wage and affordable housing, right to clean water. So all of those things that are really a part of a quality human existence. And the state legislature has the power to address all of those things, and they've decided not to, right? So if we look specifically at healthcare, you can't deny the current system is riddled with embedded structural racism, sexism, classism, and it's all disproportionately placed on marginalized and underserved communities. So, on the state level, working as a vocal proponent for what Medicare for All Florida stands for is one way to support the basic human right of universal health care. The final objective is to get this on the federal and state level. And on the state level, being able to support the updated Healthy Florida Act is an absolute top priority. I think it's important to keep that ultimate end goal in mind, but realize in the meantime, why don't we do stuff that is going to reduce and remove barriers to accessible and affordable healthcare? So let's use our time as we continue to work towards that end goal. So we are in an absolute doctors and nurses shortage crisis. So Artenesia, Pat, way to go for being in med school. You are helping our cause, right? But what about exploring a state-funded pilot program where we could provide healthcare education, schooling to qualified Floridians so that they could become registered nurses, CNAs, PAs, who would then go back to underserved communities and provide healthcare to them, right? So let's start with something like that. Let's learn from, we know the poster child for all of this. Thank you, Oregon, right? So we can look to Oregon, you can look to Colorado, New York, Massachusetts, right? As a major academic nerd, I have read way too much stuff about all of the different kind of state bills and state plans exploring how their state can achieve a single payer universal system. A great way to do that is let's take what they've done, let's learn from those states, and let's set up our own task force to analyze and explore the costs associated with different forms of the single payer system. So let's get the ball rolling and let's commit to that, so that we have quantifiable numbers to show. And then that way, you can't deny how it would work. Gosh, there's so many other things you could do with policy around things like capping specific prices for care on like inpatient and outpatient hospital rates. So reading like with Oregon, they've projected in just the next 2 years, by capping those inpatient and outpatient rates, they're going to save $160 million. Why don't we go ahead and try to get a health insurance commissioner or a task force that is going to start to outline the ways in which we can control price growth, so that as we work towards getting that Healthy Florida Act bill passed, we can actually try to make things more affordable for people, so that breaking a leg doesn't break the bank, right? It shouldn't cost thousands of dollars to fix a broken arm. The other thing that I think is something that we can do that is really important is dealing with prescription medication costs. They are out of hand. So expanding capping or putting, they're called upper payment limits on what an individual would pay for some high cost drugs. So we know that this is going on with insulin, but there are a lot of other really popular, and in a state that has going towards an elderly population in my district, they would really benefit from reducing the costs for their prescription. So, you know, you could put together a prescription drug affordability board where Florida, just like they regulate public utilities, maybe not the best on regulations for public utilities, since they keep letting the rates go up, but you could establish that as a board to then cap those prices. You could penalize drug manufacturers for increasing prices that aren't supported by clinical data. So there's a lot of ways in which on the state level, you can use your power as a legislator to advocate for making things affordable as we work towards the long-term goal, right? We want universal health care for all. But in the meantime, as we work towards that as the reality, let's work diligently to make healthcare affordable and accessible by reducing and limiting health provider and system administrative costs. Let's limit and cap price increases. Let's restrain growth on provider payment rates, and let's do something about what's going on with prescription medication costs. So that's my spiel. And I really think that there's a lot of ability, if we can get enough people to realize that the state has the power to do this, that we can. So thanks for listening, and I greatly appreciate the support and the platform to be able to get the word out there about Medicare for all, because it's something we need to support. So thank you.